guys. So collaborative practice. This is obviously a big one in the midwifery world because, in most states we're required to collaborate with a physician. But we also know that collaborative practice reaches, all areas. There's all kinds of collaborative practice and all kinds of disciplines that come together for healthcare. So collaborative practice, can it work? I think that with the right support, collaborative practice can work. Not only can it work, but I think as providers we must make it work because as healthcare transforms, we're going to be left behind if we don't. This means that each collaborating party has to be willing to depend on the other and work together successfully. We've been learning these collaborative skills basically since kindergarten, and it's really time to embrace them. The time is now because healthcare is changing, and it's embracing this collaborative practice that is going to really expand healthcare. There's great value in the collaboration of a bunch of minds versus one mind. So I think if healthcare providers can envision the same goal and act, not in the interest of our own goals, but in the interest of the patient, and have the patient as the center, and have a unified goal. If everyone's on the same page, then I think collaborating can be successful. So my experiences with collaboration, I work with a group of midwives, and they work with two collaborating physicians. So if the patient becomes complex or high risk at their facility, they consult with these two physicians, and they will see the patient, the physicians will, and help co-manage their health care. So these physicians, fully support midwives and their practice, and they allow them to practice freely, to the extent of their licensure, and while still supporting them even further, should the patient require a higher level of care. This allows these midwives to practice without micromanaging and still have the collaborative resources that they need should that patient require it. So I've really had a positive experience with collaborative care, and I've seen that it truly can work, especially in the setting that I'm speaking of, although I know it does not always work this way, and there's other places that I've worked where there is zero culture for supporting midwives and some other interdisciplinary groups, to the point that many midwives have come and gone, and we now have no midwives in that area because that culture was not supported and the physicians did not support midwifery care, which is sad to me because, like I said, this is the way that healthcare is going, and that's disappointing. It really is. So, question, I'm curious if you guys have collaboration of midwives in your workplace, and are they supported there, or are they driven off, for lack of a better term? So, what are the benefits to collaborative practice? As Maria Wamsley stated in her video, there's so many benefits to collaborative care, and I'm just going to highlight a few that I agreed with that she mentioned. So, highest quality of care. Collaborating provides an environment in which we can promote highest quality of care and thus improving outcomes for our patients, which is obviously our goal. Collaboration of minds and ideas will be more fruitful in generating plans of care. So, like I said before, collaborating with more than one person obviously is going to generate more ideas and create a better patient-centered environment to help that patient. And this leads to my next one. So, different specialties coming together provides multiple specialized healthcare perspectives in one visit if we collaborate. Thus, this is going to prevent rehospitalization, which is huge, especially with reimbursement and stuff in the hospitals. We know we want to decrease that rehospitalization rate, not just for the readmission rates, but also for the better of our patients. It's going to increase patient safety, so you have more people looking at things, more people giving ideas. Your patient is going to be safer because of that. And it's also, in relation to that, going to decrease error rates. You're going to have less error rates. The more people you have on board, you're going to have different eyes looking at different things, and you're going to decrease those error rates because it's not just one person we're relying on, but it's multiple people. And then as far as comorbidities go, it means, a lot of our patients nowadays have these comorbidities, And it means that, there's more than one issue that our patients are coming to us with. They may be here for an exacerbation of XYZ, but really they have, ABC going on. So this means that, if we collaborate, that if they have more than one issue, they can benefit from this teamwork as we acknowledge all comorbidities while they're there in the hospital, while they're with us in the office, which again will prevent that rehospitalization and prolonged hospital stays. So, ACOG committee opinion, why is this an example of collaborative practice? So, first of all, I love ACOG opinion 687, and a lot of their opinions actually that ACOG puts out are in collaboration with other people, but this one specifically that we read about this week, ACOG opinion 687, I wish that rather than picking and choosing which opinions best serve them to implement, that hospitals would embrace this collaborative, specific professional recommendation, but they don't, not all of them anyway, but it's slowly changing. That culture is starting to change. But this opinion is an example of collaborative practice because it was developed not only by ACOG, but in collaboration with American College of Nurse Midwives and also the Association of Women's Health, Obstetric, and Neonatal Nurses. So right there you have, a couple groups coming together. So these groups collaborated and came together to create these safer and evidence-based recommendations that are, in my opinion, phenomenal and should be embraced and have the possibility to transform our OB world, all because multiple disciplinary groups came together, and we definitely need more of that collaboration so we can get more things like that out there, because I really think that the OB world is going to benefit from this one recommendation. So definitely collaboration there. So question, what are your thoughts about the ACOG opinion 687? I know that's a loaded question. And how can we encourage more places to support this collaborative opinion? And that's it. Thanks, guys.